Hi and welcome. I'm trying to learn medicine. Today, Angina Pectoris, and after we've done it, we're gonna do central body training. And if you participate in this central body training, that is but at your own risk. And this is no medical advice here, we're just talking about it, and we're talking about internal anatomy and blood system. But this is no medical advice. And this is the second time that we're doing Angina Pectoris, so now we're trying to do a presentation about it, to learn it and then to present it. Angina Pectoris, attacks of choking or throttling pain across the upper part of the chest due to reduction of the blood flow through the coronary arteries which supply the heart muscle. Okay, a feeling of choking or throttling in the pain in the chest because the coronary arteries which are supplying the blood the heart with blood are obstructed, having a reduction in blood flow. It occurs in spasms and is usually brought on by exertion and relieved by rest. It occurs in spasm. I don't know really what it means, what spasms are. It is brought on by more exertion and goes a bit by resting. Atheroma of the coronary arteries is the most common cause. Other diseases such as anemia may produce the same type of pain. Okay, the other types of diseases like anemia, that is a reduction in the hemoglobin amount, functioning hemoglobin amount of hemoglobin cells in the human body, which are transporting the oxygen through the body, or atheroma, that is, I think it was fatty, that is fatty things going into the arteries, and to get away from it, I don't know the name for it. Atheroma. Fatty deposits. Fatty deposits develop on the artery walls, which when hardened, Fatty deposits develop on the artery walls, which when hardened, producing a condition known as sclerosis. Okay, by atheroma, fatty deposits are depositing at the artery walls and hardening them and causing sclerosis. They are enlarging and narrowing the arteries. Okay, hardening the artery walls, and the deposits enlarge into plaques, which together with the sclerosis lead to narrowing of the artery. Okay, they're hardening them, getting sclerosis, and also are they narrowing through the enlarging of the plaque with fatty deposits. And to get away from that, they're saying doing fitness and not to overeat and not to be overweight and to stop smoking. Now I find it interesting. I wanted to point that out, but I don't think I did that when we did atheroma. That they are writing in one point not to overeat, and another one to keep a good diet. They've written something else as I thought. Okay, I thought they were separating between eating so much that adipose tissue is formed and overeating. Like, basically the question is, does atheroma occur if a person eats so much that they are developing adipose tissue, or is it just if a person eats one time very much? So basically a hearty meal's the problem for atheroma. Okay, atheroma and anemia have similar pains. Atheroma of the coronary arteries is the most common cause. Okay, atheroma is the most common cause, and other diseases such as anemia may produce the same type of pain. Okay, and the pain is a throttling, choking pain across the upper part of the chest, caused through a hampered amount of blood supply through the coronary arteries to the heart. What was it? Reduction of the blood flow through the coronary arteries. And they are supplying the heart. Okay. It gets more for exertion, less for pausing. The pain usually begins across the upper part of the front of the chest, and can spread to the jaw and down the left arm, and sometimes the right also. Jaw and down the left arm. The pain can be described as tight, heavy, constricting or crushing, and sometimes numbing or burning. It is never throbbing or knife. What would be knife? Knife. It is never throbbing. Attack of choking or throttling. I thought they knew about the way of I don't know which one I is. I never know what throttling pain or throbbing pain is. No, whatever. And knife-like, I don't know what to say with knife-like. I don't understand. Okay, it is a tight and heavy, constricting, crushing, numbing, and burning pain. Let's go on and prepare. The pain usually lasts a few minutes and is precipitated by exertion or a meal and passes off with rest. Also through a meal. It gets worse through a meal, through exertion, can be also through a meal, and goes then slowly away through resting. Okay, duration. Once angina develops, the attacks usually recur. With treatment, the frequency of attacks can be reduced and may ease completely. Okay? If it is where it happens, makes sense? Occasionally, despite treatment, attacks become increasingly frequent. Causes. Exertion, such as walking, especially against the wind or up an incline, but I think they mean if people have a thrombosis of the coronary arteries and have then exertion. Cold weather, and the same thing. I don't think cold weather causes angina pectoris. And next thing, emotion, which can be brought on by an argument, shock, violence, or excitement on television. Let's stay as just an argument shock, but I don't think we have time anyway. Heavy meals also. Complications. A clot may form and block the coronary artery and cause coronary thrombosis. But that seems to be more a complication of the atheroma, not of the angina pectoris. Maybe we're going to complete it all. But I'm trying to say that if these fatty deposits of the atheroma, which have hardened and caused sclerosis and narrowed the coronary arteries, result in angina pectoris, then it also can happen that blood clot forms and blocks when the coronary artery, causing coronary thrombosis. Treatment in the home. Sit down and rest. If you are walking in the street, stand still. The pain should be relieved within a few minutes. So sit down and rest, or rest basically. Reduce emotional stress if possible. Attacks brought on by emotion are sometimes difficult to relieve. Take a sedative if one is available. If not, an alcoholic drink can be a useful alternative. What? Take a sedative if one is available. If not, an alcoholic drink can be useful. Did I not notice when we read it the first time? They are actually at one point here advising to take an alcoholic drink. Otherwise, we're always saying stop drinking and stop smoking. Now again, this is not medical advice, we're just reading that here. Do not continue exercise or activity, but we're saying for atheroma, that's the thing. No, so basically we're having it here. What do we say exactly to atheroma? Exercise regularly throughout life. At least twice a week. Exercise should be strenuous enough to leave you out of breath and quicken your pulse. But if exercise is resumed in middle age after years of inactivity, there should be several months gradual build-up to strenuous activity. In any event, you should consult your doctor before undertaking any exercise. Because I'm a little wondering about what type of exercises now. Because when people have angina pectoris because of atheroma and the solution against atheroma is exercising, then do not continue exercise or activity. Yes, if there's an angina pectoris attack to them. And they said by the other thing, start slowly. Do not continue, because if the pain is not relieved within 10 to 15 minutes, consult a doctor. The doctor will need to find out the cause of the angina and to assess its severity. If it is mild, no treatment will be needed. But if it Would it not make sense if it gets worse? If it is mild, no treatment is needed, but it will probably get worse. It is cause for ephyreoma, which gets more and more worse. But if it is serious, then various medical treatments are available. If it would be able to measure ephyreoma already early in life, then it would be possible to not just use exercising as a preventive, speculative, maybe something could happen, sondern as an actual treatment, because the ephyreoma had already started. Maybe it would be something interesting, an interesting idea. If it is possible to find out how early ephyreoma starts, and if it is measurable, easy measurable for people, that they know that they're already starting to develop ephyreoma. If it is not responding to medical treatment, the diseased artery can be surgically removed and replaced with a vein, graft, or opened up by inflating a tiny balloon in the artery, angioplasty. Prevention. Avoid conditions which produce the pain, for instance, exertion, especially after heavy meals in cold or windy weather. Your doctor may prescribe tablets which you can safely take before exertion to prevent the onset of pain. For long-term prevention, do not smoke. Keep your weight down to an ideal level. Increase physical activity, but avoid precipitating an attack of angina by using your tablets if necessary. So if you already have physical conditioning, but exercise often reduces the severity of angina, but be guided by your doctor. Outlook. The outlook for angina sufferers depends on the underlying cause. Even when the coronary arteries are diseased, reduction of weight and stopping smoking may relieve the angina completely and may also improve the condition of the arteries. Now, we are over time. We don't have time left for the presentation, but we're pretty close. We can do it the next time. It means if you were here for medicine, you can go directly to the next part of medicine. We're going to try to do the presentation about angina pectoris. If you stay here and participate in the central body training or body central training, then it's very obvious. As I said, you should consult your doctor before you just breathe. Now, if you participate now, it's very obvious. We are starting and we're having the legs standing around hip width wide apart. We're going a bit down into the knees and now flex all the upper muscles of the legs and press up the legs together. Now straighten one leg, keep pressing the legs together, contract the muscles and press it together and land again the leg after having it completely straight. And now the other leg, straighten it, press together the legs, flex the muscles and into the middle. And now a little wider apart and contract again the muscles and press the legs together. Now straighten again one leg and come over to the side. Press the legs together. Try to flex the muscles. And bend again. Press together. Flex the muscles. And back. And now also for completeness, press to the outside. Okay. Now one leg up and press on the top. And press on the outside. Right angle with the leg, flexed foot, even line hips, taller with the back, little bend in the elbow. And press with the knee up and to the side, up and to the side. Other leg up and press on the top. On the inside. And press up and to the side. Up to the side. And now 1, 2, or 3 exercises on the ground. So first elbow to the side and side plank. You can also bring also knee down. And now if you like, bring one leg up. Now if you like, you can come onto one hand. Bring one leg out and then hand out. Bring knee and hand, elbow together. And one more time. And over to the other side. First side plank. Now if you like, you can bring one leg up. And now, if you can and like, you can come onto the foot hand. And bring one leg up. And bring elbow and knee together. We're doing a walk a bit on the place. And legs wide apart, breathing around. Breathe out. Okay. Out. Breathing across the legs. And breathing in out. Now it's also fast. Central body training. I thank you very much, and until next time.